Hello, everybody, and welcome to another Lanby Community Group session. Today's topic is heart health, and we're going a little bit beyond the beat. To summarize what we will do today, we're going to start with understanding how the properly functioning heart works, discuss what happens to the damaged heart and how that occurs, understanding a bit more about testing and lab values, review prevention strategies, including medication, lifestyle, nutrition, and supplementation, as well as physical activity, and then sort of just wrap up. So in order to get started, I think a good place is to get a little bit of the anatomy of the heart down. So the heart is about the size of a fist and it sits slightly to the left in the middle of the chest. The heart is made up of three layers: the epicardium, which is the outermost layer, the myocardium, the middle layer, and the endocardium, the innermost layer. The pericardium is a fluid-filled sac that surrounds your heart. The heart consists of four chambers, two on the left and two on the right, separated by a wall, which is a muscle called the septum. The two small upper chambers are the atria, and the two larger lower chambers are the ventricles. When we think about our heart in homeostasis and balance, the major function of the heart really is the muscle of the circulatory system. This muscle pumps blood throughout the body and sends oxygen and nutrients to the body and carries away waste and carbon dioxide. The right side of the heart receives blood that is low in oxygen because most has been used up by the brain and the body. This oxygen then returns and is pumped to your lungs, where it picks up a fresh supply of oxygen. The blood then returns to the left side of the heart, ready to be pumped back into the body and to the brain and the rest of the body. This is all happening through a system where the blood travels through arteries, capillaries, and veins. Arteries carry oxygen-rich blood from your heart to all parts of the body, getting smaller and smaller as they get further away from the heart. Capillaries kind of connect the smallest arteries to the smallest veins, helping exchange water, oxygen, carbon dioxide, nutrients, and other waste products. And then finally, veins then carry the blood that is lacking in oxygen back towards your heart, and the veins get bigger and bigger as they get closer to your heart. These blood vessels are able to widen or narrow depending on how much blood each part of the body requires. And this widening or narrowing is also really firmly controlled by hormonal activity. The heart also has four valves that keeps the blood flowing in the right direction. So when we think about testing in labs and trying to figure out how the heart is doing from a lab value perspective, there's a few things we like to look at on top of some extra components we like to look at in the Lanby. So total cholesterol, when we think about the entire picture of LDL, HDL, VLDL, and triglycerides, we get a number of our total cholesterol. And basically the goal is to be less than 200, but really somewhere between 120 and 130 is ideal. Now, less isn't generally better, just because at some point we have to understand cholesterol is needed for other things throughout the body, especially formation of testosterone. So we don't want zero total cholesterol, but we definitely want somewhere below 200 and maybe more in this optimal range. LDL is considered the bad cholesterol. With this, we want our number to be under 100. And if you do have any comorbidities, such as diabetes or any other risk, we would really like this number to be under 70, so that we are more or less concerned about the actual impact this has on other health conditions. So we want this number to be even lower when we have something like diabetes, so that the risk factor of diabetes is even less, especially in terms of the heart health. The HDL is the good cholesterol, quote unquote. And ideally speaking, we would want men above 50 and women above 60. And HDL is actually something that really is dependent on exercise and activity. HDL works to remove cholesterol from your arteries and transport it back to your liver, where it can be eliminated from your body. So HDL is working to help us lower LDL. Triglycerides is a type of fat found in the blood. High levels of triglycerides can contribute to plaque, which we'll discuss in a bit. Ideally, you want these numbers to be lower than 100, but greater than 40. Again, we do need some triglycerides in our system. And triglycerides is very influenced by simple sugar intake. So high amounts of sugar in your diet will lead to higher amounts of triglycerides in your blood. At the Lanby, we like to go a little bit further and look at a little bit more detail. So one of the levels that we look at is ApoB, which is the main protein constitute of lipoproteins LDL and VLDL. So ApoB is a big part of what we would consider two of the bad cholesterol components. It binds to the surface of the lipoproteins and facilitates their interaction with the receptors on cell surfaces. And it basically, ApoB plays a role in the assembly, secretion, and uptake of lipoprotein from the liver. The amount of ApoB in the bloodstream is considered to be a more accurate indicator of cardiovascular disease risk, even more so than LDL or cholesterol alone. So we really want to look at ApoB levels and get an ideal or optimal range, which for us would be below 65, and in this case, lower is better. Lipoprotein A is another lab value that we like to look at here, specifically at the Lanby. And interesting thing about lipoprotein A is it helps us determine genetic risk. And so if you're under 30, then you have a low risk for any genetic predisposition to cardiovascular disease. Above 30, you have a higher risk. Now, this is something that really doesn't move with any sort of interventions, again, because it is indicative of genetic risk. We kind of group homocysteine and CRP together since both are sort of looking at inflammation in the body. Homocysteine can be influenced by B vitamins, so we may look at B vitamin lab values to understand if this is more risk based on cardiovascular disease or maybe more risk based on a low B vitamin. Versus CRP is really down to the T involved with inflammation. And sometimes this number can be severely elevated due to some sort of acute illness. Again, but if it's chronically elevated, we may consider that to be of high risk for heart disease. And then outside of our labs, a couple of other things we want to pay attention to are blood pressure and BMI. Now, BMI is not necessarily the greatest indicator of health, but it can give us an idea, especially when we take into consideration body composition, which is something we do here on the InBody here at the Lanby. So if your BMI is slightly above normal or even somewhat above normal in the overweight range, but you have a really high muscle mass percentage and a really low body fat percentage, BMI isn't necessarily an indicator of health. But blood pressure is definitely something we want to discuss, and we will tap into that a little bit more. So when we think about what can damage the heart, there's a couple of the main hitters. High blood pressure, which we just mentioned, dyslipidemia, so changes in that lipid panel that we just reviewed, obesity and diabetes, which are sort of grouped together here. For many reasons, they are connected, and smoking, which in general is just not good for us, but we'll explain why. So high blood pressure is really considered the silent killer. A lot of the times people are walking around with high blood pressure and they don't even realize it. The bad thing about this, or the important thing about knowing what your blood pressure is that this can do damage over time. And basically this increased blood pressure adds force against the walls of your arteries. And when this happens constantly or consistently, this damages the arteries, causing them to stretch and weaken, which allows the buildup of plaque. So we mentioned plaque before, and basically what plaque does is narrow the arteries, reducing blood flow to the heart, damaging the heart muscle, and increasing the risk of heart attack. So you can think about it twofold, and we'll talk about diet in a bit, but you can do damage by adding plaque. But if you have this weakened sort of system because of a chronic increase or elevation in your blood pressure, you're more likely to have more plaque, which is more likely to do more damage. And again, this can lead more likely to a dangerous acute event like a heart attack. So when we think about what affects blood pressure, we want to think about first maybe the diet. And the one that we all kind of know is sodium. What happens with sodium is it retains water in the body, which eventually will increase the blood volume, and this puts more pressure on the arteries to push the blood volume, eventually raising the blood pressure in order to push the blood volume. Magnesium plays a role in regulating blood vessels and blood flow, and so a deficiency in magnesium can contribute to high blood pressure. So we can look at magnesium levels. We sort of suggest magnesium supplements for ample amount of reasons. Just general health is one of them, including general heart health. Potassium sort of works as the counteract of sodium by promoting the excretion of water and relaxing the blood vessels. So we can think of some high potassium foods that we can intake, but again, generally speaking, we can look at your lab values and make sure this is balanced. But why not go for an extra banana or two? And then finally, caloric surplus can just lead to weight gain, which is the next line. Weight can increase the workload based on more blood volume, which will put more pressure. We also see some negative hormonal changes with increased weight. And again, hormones play a huge role in controlling the way your blood pressure and your blood moves throughout the body. Having a sedentary lifestyle will actually lead to less dilation and a weaker heart. So obviously the opposite of that. And again, we'll talk more about sort of the things to do to prevent. Alcohol can cause dehydration and direct stimulation of the heart, making your heart work a little bit harder. Smoking will go into detail. And then stress can cause, especially chronic stress, leads to chronic inflammation. And this can lead to the constricting of the blood vessels. Dyslipidemia goes back to the labs that we discussed before, and we're really highlighting two for the dyslipidemia here: the LDL, quote unquote, bad cholesterol, and the HDL, the quote unquote, good cholesterol. So elevated LDL can contribute to inflammation and can contribute to plaque buildup in the arteries. Again, that plaque buildup will then narrow the arteries, restricting the blood flow. Next, we want to look at your HDL, which again is your good cholesterol. But having low HDL can cause a reduction of LDL removal, and then we can go back to what LDL elevated will do to you. So less HDL means less removal of LDL, which probably means an elevated LDL, and that will contribute to the inflammation and the plaque buildup as suggested prior. Causes of reduction of LDL removal, right? So again, if we don't have high HDL, meaning less exercise can be something that contributes here. Dietary factors such as increasing saturated fat and simple carbs, which increase, again, total triglycerides, cholesterol, and LDL. Sedentary lifestyle, lower HDL, as I mentioned. Smoking, alcohol directly increases LDL and triglycerides, especially depending on what kind of alcohol. Alcohol on its own will do it, but sweetened beverages can do it even more. Chronic stress will increase LDL, triglyceride, and decrease HDL. Other chronic diseases like diabetes, chronic kidney disease, liver disease can all impact your lipid panel. Genetics and age as well will lead to a difference in your lipid panel. And so one of the main hitters, which we'll talk about next, being diabetes, plays a huge role in dyslipidemia. So as alluded to, obesity and diabetes are very connected. They're not necessarily hand in hand, but obesity can lead to type 2 diabetes. When we think about what obesity does with an increased weight, again, it increases the workload on the heart. This causes a higher blood pressure, and again, higher blood pressure can weaken the walls, contributing to buildup of plaque, which will then lead to dyslipidemia, insulin resistance, increased inflammation, and can lead to sleep apnea. And sleep is an important factor in terms of our total health, but we'll discuss in a bit about sleep in terms of prevention. So when you increase your weight, not only are you more likely to lead towards diabetes, especially if you're in an excess weight for an extended period of time, but you're also leading to things like dyslipidemia, insulin resistance, and just chronic inflammation. Diabetes raises blood glucose levels. And this increase in blood glucose levels can actually damage the inner lining of the blood vessels. And this will lead to the accumulation of plaque. Increased blood glucose levels will also lead to inflammation and dyslipidemia. So diabetes itself, you are not only monitoring blood sugar levels like glucose, fasting glucose, and insulin, as well as A1C, but we also have to really monitor your lipid panel, because diabetes definitely leads to dyslipidemia, and this is one of those comorbidities that we talked about when we want a more optimal LDL because of something like diabetes, because the risk factor increases because of the damage that the diabetes can do to the system. So obesity and diabetes, and then moving on to smoking. So really, smoking just plays a direct impact on heart health. It directly damages the lining of the arteries. It increases blood pressure and heart rate, reduces the amount of oxygen carried in your blood. Therefore, your body has to work harder to send nutrients and oxygen throughout your body, causes inflammation, damages the heart muscle directly, and decreases exercise tolerance. And again, we need exercise in order to help our lipid panels. So I think we all know this by now, but smoking is definitely a no-no and something we really, really want to consider quitting, or if not decreasing, and talking to providers to help you with that. So we've gotten to know a little bit about the heart imbalance and the heart damage. So how do we prevent this damage to make sure we stay in balance? Well, some of this can be through medication, nutrition, physical activity, supplementation, and some other lifestyle interventions. When it comes to medication, the first line of defense typically providers really lean into are statins. Statins are a treatment for lowering LDL cholesterol, and it will help lower ApoB levels. It does so by inhibiting the production of cholesterol in the liver. Statin does have some side effects, and therefore it may be considered a drug not useful for some people. There are different types of statins that we use in order to mitigate the side effects, but your provider will go through all of this based on your risk factors, your side effects, and your targeted goal. Ezetimibe blocks the absorption of cholesterol from the intestines. This is maybe a lot less popular and less used than statins, but is something that, depending on your profile, may be of use for you. Again, just the general overview of the drugs used. The indications are really based on your provider's judgment, as well as your medical history and outcome goals. PCSK9 inhibitors are sort of a newer medication. What it does is it blocks the PCKS9 protein, which helps to remove LDL cholesterol from the bloodstream. So again, gaining more traction may not necessarily be something your provider jumps to right away, and is also kind of expensive still. So likely not something you will use as your first line of defense for elevated lipids or dyslipidemia. Bile acid sequestrants bind to bile acids in the intestine, preventing them from being reabsorbed and leading to a decreased cholesterol production. We'll kind of talk about something similar when it comes to dietary adjustments and fiber. And lastly, fibrates lower triglycerides by reducing the amount of VLDL in your liver. There is some thought that this can also lower your ApoB levels, but for now, I think this is something that's used a lot less often, and again, really depends on the clinical picture. So because we're thinking of prevention, nutrition and lifestyle and supplements are probably that first line of defense, while medication is likely the second. Although we are living in a time where we know prevention is very, very important, and we're thinking more than just chronic disease, we're thinking about optimization. So medication management may be used earlier and earlier, especially with statins, to help get you to more optimal levels, so we can almost see it as prevention. But really, the first line of defense is lifestyle and nutrition. So the number one food to think about in terms of adding to your diet and making an impact is fiber. So fiber actually binds to bile in your body and excretes it. Bile is necessary for fat metabolism, and a precursor to bile is cholesterol. Therefore, in order to make more bile, we have to pull from cholesterol, and one of the places we'll pull from in order to do so is blood cholesterol, which ultimately lowers your blood cholesterol. So increasing fiber can directly lead to lower cholesterol. Sources of fiber include fruits and vegetables, whole grains, nuts and seeds, beans and lentils. You can also get fiber supplements, but we'll talk about that in a bit. Beans and lentils are very, very potent, about 1 cup given about 14 grams or so. And while all fruits and vegetables are very healthy sources of fiber, you can lean into ones that are just a little bit more fiber happy, such as berries and raspberries and pears, and things like Brussels sprouts. But really, just increasing your total amount of fruits and vegetables will help with increased fiber and lowering your cholesterol. Another approach to a dietary change is thinking about an anti-inflammatory diet overall. So what this includes is increasing the good nutrients in your diet. And one in particular, unsaturated fats, as unsaturated fats have the capability of lowering LDL, your bad cholesterol, and raising HDL, your good cholesterol. Some of the places we find these unsaturated fats are nuts, seeds, olive oil, avocados, and fatty fish. And again, in reference to a supplement we'll discuss in a bit. We all have heard of fish oils and omega-3s. Well, we can definitely get that from our walnuts and from our fatty fish as well for the specific omega-3s. However, nuts, seeds, olive oil, avocados, and fish in general are healthy sources of fat that can help with lowering your LDL and HDL. We also get a good amount of phytochemicals and vitamins and minerals from the fruits and vegetables, which play many roles in inflammation. Again, we talked about things like magnesium and potassium playing a role in sort of blood pressure. So increasing the color and tasting the rainbow in your fruits and vegetables play a huge role in heart health. So on the other side of the coin, things that cause inflammation that we sort of want to limit and avoid in our diet include saturated and trans fat. They directly raise your cholesterol. Trans fat, we all know at this point, is sort of a no-no. It's out of all of our food products, but it does happen when we cook. So frying things and deep frying things and refrying things can cause a saturated fat to turn into a trans fat, which is the most unhealthy fat that is available to us. Saturated fats, again, can go a little bit in two directions. I think the idea when we hear something like red meat and saturated fat, we automatically think of it raising cholesterol, but the quality of the saturated fat matters. For example, actually avocados and coconut are high in saturated fat, but it's a healthy saturated fat. So if you look at a label and let's say you're getting like a popcorn that's made with avocado oil or coconut oil, the saturated fat may be high, but that's okay because it's coming from one of those two sources. Red meat is a saturated fat that isn't great for us. However, quality really, really matters here. If there's one place where I'm looking for the buzzwords like organic, cage-free, free range, it's definitely red meat, because if the red meat is raised right, then the saturated fat will have very little, if any, impact on your cholesterol. Again, unless moderation isn't something we're considering and we're just eating red meat 24/7. Even quality red meat at some point is going to raise your cholesterol. Processed foods like chips, crackers, granola, candy bars are usually loaded in saturated fat and can cause inflammation. And then again, chronic inflammation can impact our heart health. Along these lines is sort of added sugar, so sugar-sweetened beverages, candies, other processed foods, condiments, sauces, baked goods. Both of these are kind of connected in the fact that they're processed, high in sugar, high in saturated fat, and can raise, again, triglycerides, cholesterol, and overall cause inflammation. And actually, both can probably lead to gaining weight and obesity, which, again, translates back to impacting our heart health. We spoke a little bit about this beforehand when it comes to blood pressure, but depending on where you are, you may have to monitor your intake. Not everyone has to pay as close attention to sodium intake unless you're diagnosed with high blood pressure. So if you are diagnosed with high blood pressure and you're medicated, likely the impact of sodium in your diet is going to be greater than if you're not medicated and you don't have high blood pressure. You can be a lot more lenient with sodium in your diet. Sodium is important, but again, with high blood pressure, we want to limit how much we're taking in. This can be 2 grams for a lot of people, and we can do so by not adding table salt, using spices and herbs that are salt-free, washing our canned goods, avoiding packaged goods, and choosing low sodium labels, as well as really just paying attention to if you're eating out. If that has high sodium, typically it's going to increase. But if you can choose meals that are lower sodium when eating out, it's definitely best practice there. Potassium, again, can do the opposite of what sodium does, and therefore, just like anything else, increasing a little bit can be a positive thing. So look for your potassium in things like bananas, oranges, avocados, spinach, and potatoes. And finally, in general, what we want to talk about is things you can do to sort of increase your day-to-day diet quality. Opt in for lean protein, chicken, turkey, fish, and eggs. Protein can help with appetite and satiety, which in turn, if we're thinking about weight management and how that may lead into diabetes, this can really help with decreasing body weight by helping with weight management through appetite. Cooking more meals at home, as I mentioned, you're in charge when you're cooking at home versus when you're eating out. They tend to add in more sauces, add in more sugar, add in more fats, add in more sodium to make it taste better. Unfortunately, their bottom line is profit, and something that's profitable is probably something that tastes really, really good. And so when you're cooking at home, you can use other seasonings and be a lot more thoughtful and conscious about how you're cooking your meals. Read food labels carefully, look at sodium content, look at saturated fat. Where is it coming from? Is this a good source of fiber? Can I increase my fiber? Is this a good source of protein? Should I double up my portion? Including not just the nutrient facts label, but also the ingredients. Where are these coming from? Do you see cane sugar in the first 3 ingredients? So it's super high in sugar. Do you see a vegetable oil being used? Things like that we can avoid by reading a label. Controlling portions, as I mentioned, with the appetite control with protein, increasing things like your non-starchy vegetables, having a small portion of complex carbs, making sure there's a healthy saturated fat, but sticking to a portion that helps you either manage your weight or bring you to a more appropriate weight. And generally speaking, you just can't go wrong with choosing whole foods. So if we're avoiding processed foods, if we're eating mostly the outskirts of a supermarket, produce, meat, eggs, some dairy or dairy alternative, depending, we really won't go wrong. What leads us astray is the processed foods we find in the middle of the supermarket. And so avoiding packaged goods as much as possible, of course, except for things like lentils and beans and whole grains and oils that are healthy. We find those in the middle aisles and they're important, but a lot of the junk comes from the middle aisles. Stick to things with little labels, no labels, minimal labels. The next thing to think about in terms of lifestyle is physical activity. Increasing physical activity can help strengthen the heart muscle, lower blood pressure, lower cholesterol, increase HDL, improve insulin resistance, so mitigating the effect diabetes has on us or decreasing or preventing the chance of getting there. Will help promote weight management and increase blood flow, helping to deliver oxygen and nutrients to the cells and remove waste products. Overall, exercise will also help reduce inflammation. So when we think about exercise, I think the idea really is just daily movement. My bare minimum is 4 days of exercise because at least 4 out of 7 is most days of the week. But typically speaking, 30 to 60 plus minutes Monday through Sunday is ideal. A recommendation is 150 minutes of moderate or 75 minutes of intense or some level of those two combined. But again, unless you're hurting yourself, this is the one situation where more is probably good. And think about all types of physical activity. Do things you enjoy, go on hikes, take a class, ride a bike, play a sport. but also think about resistance training and how that it can impact your muscle mass, which impacts your metabolism and your insulin control, as well as body composition. So aiming for 2 to 3 days of some sort of resistance or strength training, whether that's bands, Pilates, or just a typical generic go to the gym and lift some weights or use the machines. But exercise is very, very important and should be something we really consider doing daily, especially if you have a more sedentary lifestyle when it comes to the rest of your day. If you're working from home, if you're working behind a desk, if you're not on your feet all day, we really want to make sure we're spending at least 30 to 60 minutes doing something active. Supplements is something we can consider as well, either from a prevention strategy or maybe a first line defense before medication, and as well as to complement the diet. So as we mentioned, omega-3 fatty acids can help lower blood pressure, triglycerides, increase HDL, reduce inflammation, and really decrease LDL as well. Uh, when you're thinking about fish oils or just like any of these supplements, a really important topic is making sure you choose quality, reputable places. And we will help guide you with that, but you're looking for third-party testing, and you're looking for more reputable brands that have been around a while and are very upfront with their products. Coenzyme Q10 is an antioxidant that supports energy production. It's something that we usually put people on, especially if they're on a statin. Red yeast rice is really working in a very similar way to a statin, and can help lower your LDL. Vitamin D will help regulate blood pressure and reduce inflammation. And unfortunately, a lot of us, especially in the Northeast, are running vitamin D deficient or low, especially in the wintertime. So we regularly check those lab values to make sure you're at adequate intake. Fortunately, we can just add a supplement and bring you up there. Magnesium, as I mentioned before, can help regulate blood pressure and help maintain a healthy heartbeat. There's a lot of reasons to use magnesium, from muscle relaxing to help sleep and constipation, headaches. So likely there's a reason why you could be on a magnesium supplement. Which one we use is really based on some of those symptoms, but generally speaking, we can just introduce some magnesium to our diet. Fiber, again, we can get it from food, or we can do something like psyllium husk or some soluble fiber, which can help lower cholesterol, promotes gut health and digestion, and will actually help with blood sugar management. So one of those tips you talk about for a diabetic is making sure there's a lot of fiber in your meal, because it blunts the spike of your blood sugar after eating. So fiber can really help with that. As well as there's a lot to do with gut health, digestion, and the way our body responds to food. So a healthier gut, so fiber and probiotics, actually, we can add to this list, really, can help with the way our body digests foods, which can help with blood sugar control. And again, that has a lot to do with inflammation, blood pressure, weight, diabetes. Phytosterols can help block the LDL absorption in the gut, lowering LDL. Arginine and citrulline can help improve blood flow, similar to magnesium, relaxes the blood vessels, and potentially lower blood pressure. This is a very common thing used in people going to the gym, because it can help also with increased endurance and reduce muscle fatigue. Think of a natural source being something like beetroot juice, or just beets. Quercetin is also another powerful antioxidant with anti-inflammatory properties, as well as curcumin and turmeric. Both are really important anti-inflammatory things. So you can either get something like curcumin from your food or rely on a supplement form. And then niacin is really sort of on the edge of this list, just because there is some statistics that it may help lower LDL, cholesterol, and even ApoB levels. But there is a lot of issues with overdosing niacin. So again, all these supplements, just like your medications, you should talk to your provider before initiating, as well as your dietitian, to go over all of these to see what works best for you, especially when, in isolation, this is good for you, but we have to look at the entire medical picture, because you may not just be someone with elevated lipids or heart health. There can be a lot more things going on in your body and other chronic conditions calls for other sort of recommendations or really being careful with what we're doing in terms of medication and supplementation to make sure it's not harming you. Other lifestyle factors to think about, stress, again, chronic stress can influence your heart rate and your blood pressure. So something like elevated cortisol, this chronic elevation can damage the heart and the arteries over time, which will cause blood vessel constriction, limiting blood flow and limiting the oxygen delivered to your heart. This will impair the cell lining of the blood vessels, contributing to plaque buildup, causing inflammation, eventually elevating blood sugar. And sometimes, unfortunately, we have some unhealthy coping mechanisms to stress, such as smoking, overeating, drinking, and physical inactivity, which will drive these things even further up. So, again, a little bit of daily stress is important. It's important to have some strategies to help manage. So when we think of what that can be, meditation or guided meditation apps such as Waking Up or Headspace, restorative yoga, where you can focus in on your breathing, or just generally breathing techniques to help reduce stress and anxiety, maybe more acutely, spending time in nature, sun exposure, and then maybe therapy if needed. And there's an array of types of therapy. So depending on what may work best for you. And finally, exercise, one of my favorite stress modulators because it's killing multiple birds with one stone. And I think, again, it really can help with so many aspects of your lifestyle, especially in consideration of the heart. Sleep, lack of sleep will actually lead to elevated stress hormones, an increase in blood sugar, and an increase in appetite. It will also reduce blood flow and weaken the immune system. So, chronic lack of sleep is no good for many reasons, including things like hormonal health, but directly impacting your heart health. The goal is to aim for 6 to 9 hours of quality sleep. And the way we can do this is focusing in on our sleep hygiene. We can limit blue light exposure, so reducing phone use at night, and especially in bed or even close to bedtime, making sure that the temperature in the room is nice and cool, avoiding liquids 3 to 4 hours prior to sleep to avoid having to use the restroom. Unfortunately, that nightcap that you may feel soothe you and help you fall asleep is actually disturbing your sleep, probably most compared to anything. So limiting and avoiding alcohol use, limiting caffeine 5 to 7 hours before sleep time. So maybe finishing your caffeine by early afternoon, the latest. And then sticking to a schedule. Your body really, really likes routine. So if we can sort of stick to a similar routine, your body will get accustomed to maybe going to bed at 10 and waking up at 5 or 11 to 6. And finally, if all comes to fail, then we can focus in on some supplements to help you either fall asleep or stay asleep. And we already mentioned alcohol intake, and we should limit that for sleep and for many other reasons. But alcohol intake directly can increase blood pressure, and triglycerides can actually cause cardiomyopathy. And basically, because there's going to be less blood being delivered to the heart, it's going to make the heart work harder. And over time, what it will do is you'll see that the heart can reach heart failure faster. It's basically working double time, and that's sort of putting too much effort on the heart. And think of just like a sore muscle, and a chronic sore muscle is going to lead to damage. So what we can do for alcohol intake is, again, 0 is always better, but try to stick to moderation. 0 to 1 for women, 0 to 2 drinks for men. Think about the other things that go into a cocktail, limit sugar. So sticking to a clear spirit, maybe a light beer or one of these alternatives like the White Claw sort of things. Or try some zero proof alternatives. There are a lot of products out there that are even low sugar. My favorite one, which has some ashwagandha and some GABA in it, is hop water. So I'll drink that as a replacement for a beer. Just wanted to leave you with some additional resources, some places to find some very informative, but also very science-backed information. So you have the American Heart Association, American College of Cardiology, some blood pressure guidelines as well. And then some interesting podcasts and the actual episodes talking about heart health, diet, cholesterol, cardiovascular disease, and how to lower your cardiovascular risk. So these are all worth a listen to for sure. So that is it for Heart Health Beyond the Beat. I hope there was a lot of information here. Again, it kind of goes without saying, even though I'll say it a couple times. This is general information, and a lot of it can be applied, especially sort of the preventative tips. But when you're thinking about supplementation, when you're thinking about medication, or even when you're thinking about your specific picture, we want to look at you individually. So talking about all of this to your providers and to your dietitians so that we can make specialized recommendations for you, knowing that it is important to individualize these recommendations to make sure that you are staying healthy across the board. So please consider your heart health as one of the most important things you can, especially since it's the leading cause of death in the United States. Um, and and that's sad because it can be prevented in many ways. If you have any questions, you know where to find us. Thank you. Have a great day.